Thyroid cancer introduction. Welcome to our informative video on thyroid cancer, understanding the disease, diagnosis, and treatment options. In this video, we will explore the intricacies of thyroid cancer, a condition that affects the thyroid gland located in your neck. By gaining a comprehensive understanding of this disease, we aim to raise awareness and provide valuable insights into its diagnosis and available treatment options. Welcome to Medjicatives. This is the official YouTube channel of www.medjicatives.com. We believe that awareness is everything and our goal is to promote it. Section 1. What is thyroid cancer? Thyroid cancer is a type of cancer that originates in the cells of the thyroid gland, a small butterfly-shaped organ located in the front of your neck. Thyroid cancer occurs when the cells in the thyroid gland undergo abnormal changes, leading to uncontrolled growth and the formation of a tumor. While the exact cause of thyroid cancer is often unknown, certain risk factors can increase the likelihood of developing the disease. These risk factors include being female, older age, a history of radiation exposure, a family history of thyroid cancer, and certain genetic conditions like familial medullary thyroid cancer or multiple endocrine neoplasia type 2. There are several types of thyroid cancer, with the most common being papillary and follicular thyroid cancer. Papillary thyroid cancer usually grows slowly and tends to affect individuals of all ages, while follicular thyroid cancer is more common in older individuals. Other, less common types include medullary thyroid cancer and anaplastic thyroid cancer, which are generally more aggressive. It's important to note that most cases of thyroid nodules are not cancerous. However, if a nodule is found, further evaluation is necessary to determine whether it is benign or malignant. Section 3. Signs and symptoms. Recognizing the signs and symptoms of thyroid cancer is crucial for early detection and timely intervention. While some individuals with thyroid cancer may not experience any symptoms, others may notice certain changes in their body. Here are the common signs and symptoms associated with thyroid cancer. Lump or nodule in the neck. The presence of a lump or nodule in the front of the neck is one of the primary signs of thyroid cancer. These nodules may be palpable or visible and can sometimes cause discomfort or pressure in the neck area. Changes in voice. Thyroid cancer can affect the nerves responsible for vocal cord movement. As a result, individuals may experience hoarseness or other changes in their voice quality. Difficulty swallowing. Large thyroid tumors or nodules can obstruct the esophagus, leading to difficulties in swallowing. This may manifest as a feeling of something stuck in the throat or persistent swallowing problems. Swollen lymph nodes. Cancerous cells from the thyroid gland may spread to nearby lymph nodes, causing them to enlarge. Palpable and tender lymph nodes in the neck can be a sign of thyroid cancer. Neck pain. Some individuals with thyroid cancer may experience mild to moderate pain or discomfort in the neck, jaw, or ears. This pain is typically localized to the thyroid region. Changes in breathing. Advanced cases of thyroid cancer can exert pressure on the windpipe, leading to breathing difficulties, wheezing, or a persistent cough. It's important to note that these symptoms are not exclusive to thyroid cancer and can be associated with other conditions as well. If you notice any of these signs or experience persistent discomfort in your neck, it is advisable to consult a healthcare professional for a proper evaluation and diagnosis. Remember, early detection of thyroid cancer can significantly improve the chances of successful treatment. Section 4. Diagnosis and staging. Diagnosing thyroid cancer involves a series of tests and procedures that aim to evaluate the presence of cancerous cells and determine the extent or stage of the disease. Here is an overview of the diagnostic process for thyroid cancer. Physical examination. During a physical examination, a healthcare professional will examine your neck to check for any visible or palpable lumps or nodules. They will also assess your lymph nodes for enlargement. Imaging tests. Imaging tests are commonly used to visualize the thyroid gland and surrounding structures. Ultrasound is the primary imaging modality for evaluating thyroid nodules. It helps determine the size, location, and characteristics of the nodule, aiding in the assessment of its potential malignancy. Fine needle aspiration biopsy, FNAB. FNAB is a crucial diagnostic procedure for thyroid nodules. It involves using a thin needle to extract cells from the nodule, which are then examined under a microscope. This procedure helps determine if the nodule is benign, non-cancerous, or malignant, cancerous. Blood tests. Blood tests may be performed to assess thyroid function by measuring hormone levels, such as thyroid-stimulating hormone, TSH, thyroxine, T4, and triiodothyronine, T3. These tests help evaluate overall thyroid health and provide additional information for diagnosis. Staging. Once a diagnosis of thyroid cancer is confirmed, staging is performed to determine the extent of the disease. Staging helps guide treatment decisions and provides prognostic information. The most commonly used staging system for thyroid cancer is the TNM, tumor, node, metastasis, system, which considers factors such as tumor size, lymph node involvement, and the presence of distant metastasis. Staging may involve additional imaging tests, such as computed tomography, CT, scans, magnetic resonance imaging, MRI, or positron emission tomography, PET, scans. These imaging studies help evaluate the spread of cancer beyond the thyroid gland and identify any distant metastasis. Section 5. Treatment options. When it comes to treating thyroid cancer, the approach depends on several factors, including the type and stage of cancer, as well as the individual's overall health. Here are the primary treatment options for thyroid cancer. Surgery. Surgery is often the mainstay of treatment for thyroid cancer. The goal is to remove the cancerous tissue from the thyroid gland. The extent of the surgery depends on the type and stage of the cancer. The surgical procedures commonly used include total thyroidectomy, the complete removal of the thyroid gland; lobectomy, removal of only one lobe of the thyroid gland; lymph node dissection, removal of affected lymph nodes in the neck, if cancer has spread to them; radioactive iodine therapy, RI. After surgery, radioactive iodine therapy may be recommended. This treatment involves the ingestion or injection of radioactive iodine, which is taken up by any remaining thyroid tissue or cancer cells. The radiation helps to destroy these cells. RI is particularly effective for certain types of thyroid cancer, such as papillary and follicular thyroid cancer. External beam radiation therapy. In some cases, external beam radiation therapy may be used. This treatment involves directing high-energy radiation beams to the affected area to kill cancer cells or prevent their growth. External beam radiation therapy is typically used if the cancer has spread beyond the thyroid gland or if surgical options are limited. Targeted therapy. Targeted therapy is a type of treatment that uses drugs to specifically target cancer cells. These drugs work by interfering with specific molecules or pathways involved in the growth and spread of cancer. Targeted therapy is primarily used for advanced cases of thyroid cancer that have not responded to other treatments. Hormone replacement therapy. Following surgery, when the entire thyroid gland is removed, hormone replacement therapy with synthetic thyroid hormones, such as levothyroxine, is necessary to replace the natural hormones produced by the thyroid. This medication helps maintain hormone balance in the body. By working closely with healthcare professionals, individuals with thyroid cancer can receive the most appropriate and effective treatment for their specific case. Thanks for watching. Please visit our website www.medjicatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.